Have you ever been, absolutely sure you're going to make a huge change? Like start that healthy routine, finally break some old habit.
Oh, absolutely.
Yeah.
And then what happens?
Right. Suddenly it's like Tuesday afternoon and all that conscious commitment just evaporates.
It's that classic failure loop, isn't it? You pump yourself up, rely on sheer willpower, but the minute things get a bit stressful or you're tired.
Snap. Right back to the old ways. You feel stuck. It's just exhausting.
Exactly. And we often blame ourselves, think we lack willpower.
Yeah, but what if that's not really the issue? The source material we looked into today has this really interesting premise. It suggests the key isn't stronger willpower. It's better internal programming.
Okay, programming. So our mission for this deep dive is to unpack this, pretty unique approach to personal change from Dr. Naz.
Right. It's this combination of certified hypnotherapy and angel therapy.
Yeah, it sounds like an odd mix, doesn't it? Sort of clinical meets spiritual, but the promise is something they call clarity and alignment for lasting change.
So if you're the kind of person who really wants to get how things work, the mechanisms behind real deep change.
Both the psychological and maybe the spiritual side.
This is for you. We're trying to understand how they claim to, rewrite that script that keeps pulling you back.
Okay, so first step, understanding the problem diagnosis according to this source. Why is change so hard?
Their take is that you're basically working against your own programming. Your conscious mind wants one thing.
But the underlying system, the operating system, is running old software, old scripts.
And this is where it gets really specific. They put a number on it, which is kind of staggering.
The 88% thing?
Yeah. The subconscious mind isn't just big. It's apparently 88% of your total mind. That's huge.
88%.
Wow.
Just think about that for a second. That 88%, it's not just memory storage.
Right. It's where all the habits live, the automatic reactions.
Exactly. Those ingrained loops, your emotional defaults, that inner voice telling you what you can or can't do. And often that programming got installed way back, before you could really question it.
Okay, so if my conscious mind, the part saying I want to change, is only the 12%, and it's trying to fight the 88% that's running on, autopilot with old, maybe unhelpful patterns?
Well, it's no wonder willpower often feels like it just collapses. The conscious mind is massively outnumbered.
It's like trying to steer a giant ship with a tiny rudder. The sheer momentum of the 88%.
That's a great analogy, momentum. Or like gravity. Any conscious effort, like a new diet or routine, needs constant, exhausting force just to maintain against that pull.
And the second you relax consciously,
the 88% defaults just take over again, back to square one.
Okay, so that really sets up the problem. Willpower alone, just not equipped for that scale of a challenge.
Right, but what's interesting is this source doesn't just stop at the problem. It proposes a specific dual approach to tackle that massive 88%.
Which brings us to the first part, the sort of technical fix, right?
Exactly. Component number one is certified hypnotherapy, as used by Dr. Naz specifically. And we're not talking stage hypnosis here.
No chicken clucking.
No, this is clinical. It's designed to get right at that deep programming issue.
Okay, but for listeners who might be a bit skeptical or maybe only know hypnosis from movies, how does it actually work? How does it bypass that failure point we just talked about?
That's the key question, isn't it? See, the conscious 12% usually defends the old programming in the 88%. There's this gatekeeper. Psychologists call it the critical factor.
The critical factor, like a filter.
Exactly. It checks incoming info against your existing beliefs. So if someone says, you're capable, but your deep 88% belief is, I'm not good enough.
The critical factor just rejects it, like a firewall blocking a virus.
Precisely. It protects the old, even faulty code. Clinical hypnotherapy is designed to gently, temporarily lower the guard of that critical factor.
Okay. So lowering the firewall just enough.
Just enough to let new, helpful information, the new programming, the updated script get installed directly into that huge 88% operating system.
Got it. So we're not just yelling at the 12% to try harder. We're using hypnotherapy to actually, as the source says, effectively rewrite the root code in the 88%.
Yes. It's shifting from just managing surface behaviors to fundamentally recalibrating the internal system.
That makes sense if you want lasting change. You have to update the source code, not just patch the output.
That's the idea. But then, of course, it raises the next big question. Once you have access, what new script do you install?
Right, because you can install anything, technically. And that's where the second component comes in, isn't it? The one that seems, quite different.
It is different. We shift from the clinical tool to something explicitly spiritual. angel therapy.
Okay, let's talk about that. From a purely technical view, why bring angel therapy into this? What's this role supposed to be?
This is where the methodology gets really distinct. If hypnotherapy is the tool to access the code, angel therapy, according to the source, is meant to provide the blueprint for the rewrite, the direction.
Okay, so hypnotherapy opens the door, angel therapy provides the map of where to go.
Sort of, yeah. The source suggests that people often fail, not just because of bad habits, but because the new habits they try to force aren't actually aligned with who they really are or what their deeper purpose is.
Misalignment.
Right. So angel therapy here is used to help the individual connect with what the source calls their personal divine guidance and higher purpose. It's less about just fixing something broken.
And more about finding authentic direction, defining who you're meant to be.
That's the core idea, moving beyond just stop procrastinating to asking, what's my actual path, the one where procrastination maybe isn't even relevant because I'm genuinely engaged?
I see. So it's aiming for something deeper than just behavior change. It's about aligning with your divine path, as they put it.
Exactly. Because if you just use hypnotherapy to swap one habit for another, you might fix the symptom but still feel off.
Misaligned. But if the new programming installed via hypnotherapy is guided by this sense of higher purpose found through angel therapy,
then the drive becomes internal, authentic, not forced. It comes from within.
Okay, now the integration makes more logical sense. Hypnotherapy clears the internal resistance, the old code, and angel therapy provides the positive, aligned blueprint for the new code, ensuring it matches the person's deepest, most meaningful goals.
Yes, it connects the how, the clinical fix, with the why, the existential need for meaning and purpose. You're not just compliant anymore, you're authentically aligned.
And when your internal programming, that massive 88%, isn't fighting your conscious goals.
Yeah.
And they're both pointed towards something truly meaningful.
That's when, according to this source, the real transformation happens, which leads us to the promised outcome of this whole integrated process.
Right. The result of combining the technical rewrite with the divine guidance. The source calls it clarity and alignment.
Exactly. Clarity first, that comes from defining your path, your purpose, maybe through that angel therapy connection. You know where you're going.
An alignment that comes from making sure the subconscious 88% is fully on board, running that purpose-driven script thanks to the hypnotherapy rewrite.
So your internal world finally matches your external goals. The inner resistance just dissolves because the 88% has been updated to support, not sabotage, your conscious direction.
You're not just motivated anymore. You're internally programmed, deeply aligned with your highest self.
And the claim is that this integrated alignment makes constant graining willpower unnecessary. The ultimate promise is lasting transformation and success.
Because the change isn't superficial, it's at the core identity level. The default settings are reset for success.
That's the framework.
Okay, so let's bring this back to you, the listener. What's the key takeaway here as you think about your own goals, your own struggles?
Well, first, understanding why just trying harder often feels like hitting a brick wall. That 88% subconscious power is real.
Right. And the potential solution offered here isn't just one thing, it's twofold.
Exactly. It's the technical fix using something like certified hypnotherapy to get past that critical filter and rewrite the code.
And it's the directional piece, using something like angel therapy to connect with guidance, ensuring the new code leads to real clarity and alignment with your purpose.
It definitely raises a bigger question about self-improvement overall, doesn't it?
It does. This source strongly suggests that true transformation isn't just about fixing the broken bits, the negative patterns.
But it's fundamentally about defining and aligning with a higher guiding purpose. What are you moving towards?
So here's a final thought for you to consider. How much does having that defined, meaningful purpose, that divine path, matter compared to just having powerful techniques or sheer self-discipline?
Is the why ultimately more important than the how for achieving that deep, lasting success? Something to think about.
A really fascinating deep dive into a very integrated methodology. Now remember, the specific approach we discussed today, these combined sessions of certified hypnotherapy and angel therapy, that's the methodology utilized by Dr. Naz. So if tackling that 88% head-on using this kind of integrated approach resonates with you, the source material has a clear call to action. Ready to find your answers? Book your integrated session with Dr. Naz today.
And you can find out more at www.drnaz.net.